Hello, this is Dr. Lewerenz at Longevity Health Institute. I'm sure you heard recently about the unfortunate event with Luke Perry. The actor Luke Perry passed away the other day at age 52 from an unfortunate stroke that apparently he suffered a few days prior to his death. He's very young, and from all reports, not that obviously I know anything on a personal level, but he was fairly healthy and very proactive in a lot of his lifestyle. Again, a lot of this is speculation. The thing I want to share with you is about this story, and because obviously it's in the public eye, I thought I could share with you some thoughts and some things about stroke and stroke prevention and where we see things, and even our practice here at Longevity Health Institute, where we do a lot of preventative approaches, functional approaches to how you physiologically work to prevent things like a stroke. So a few things, like from a data level, actually more women than men with age have a stroke, and actually the rates go up with aging. There's a very small percentage, actually less than 20% of the population have strokes under the age of 60. Yet we're seeing younger and younger people have cardiovascular events and stroke events, and I could tell you that I'm even personally have seen it here in the practice. In fact, actually just the other day, a couple days ago, I had somebody that was very young, in their late 30s, that had two small strokes called TIAs, transient ischemic attacks. So these are things that we see regularly. Obviously, Mr. Perry had a very significant one that actually caused his an early and unfortunate death. And it doesn't always end that way. But also small strokes, significantly about 50% of people that have a small stroke, what that does is preclude in 6 months a very big stroke. So anyway, the data shows, again, more women than men. Aging does play a role. Other risk factors like hypertension, smoking, diabetes, other cardiovascular events obviously play a large risk. High cholesterol plays a large risk. You've heard me preach this before, but cholesterol is not an independent risk. It's a dependent risk. So that means if you have high cholesterol and you are a smoker, then those two raise your risks of a stroke or a cardiovascular event. But the thing is that I will tell you, and we see this very often here, and even in young people, and that is underdiagnosed or underappreciated hypertension. I can't tell you how many times we have patients here that actually come in and are young and middle-aged, and even the elderly, sometimes treated or not treated, but have uncontrolled hypertension. And they think, well, it's just related to their stress in the doctor's office. Oh, what I ate, I had coffee, I'm running around. All of that may be true, but I will tell you that we do here at Longevity Health Institute a more personalized approach to hypertension. And if somebody really has that, is we do a digital pulse wave analysis. We also check core or central aortic vascular elasticity. Okay, so stress, blood pressure, stress, caffeine, poor sleep, diet, things like this do not significantly day-to-day, minute-to-minute change that pressure. So we can tell the difference here in our practice between peripheral brachial pressure that you normally get at everyday doctor visits and a central core pressure. If your aortic or central core pressure is high, you have hypertension. You have, whether it's underdiagnosed or not, or undertreated, that needs to be addressed. Now, we often will use lifestyle modifications, some natural supplements, dietary things, means that really help your vascular elasticity and help your core central blood pressure. And we'll do a peripheral digital pulse analysis so we can really appreciate your vascular health, okay? Even if you are treated, are you treated enough, okay? Now, guidelines always suggest you should always be at least under 140/90. That's 140, the top systolic number, and 90, the diastolic. New guidelines that show that it should be even less, like 130, 135/80, which is considered more of like a pre-hypertension. But again, those are brachial pressures and need to be done appropriately at rest, no caffeine, no smoking, no stimulus, legs uncrossed, sitting in a chair for 10 minutes quietly, that's a true brachial pressure. Again, we compare brachial to central pressures. The thing though is, and this issue is, what are the other risks? So you want to look at cholesterol, you want to appreciate somebody's vascular elasticity. Hormones also play a role into vasculature and stroke. There's much higher rates of stroke levels in men when they're younger, if they go through younger andropause. So, or treated hormonally to unfortunately lower inappropriately estrogen. So you need estrogen, men too, and women postmenopausally, to keep your vascular elasticity, keep your vessels stretchy. Another interesting fact and study is on your body flexibility. It's an interesting study that shows that the further you can reach and touch your toes or beyond your toes when your back is against the wall and your legs are straight, actually correlated to less vascular events. And we believe what that has to do with is that you're very likely more limber, and your vascular stretching and circulation is a lot more efficient. And this is why something like yoga can even significantly help out vasculature and blood pressure and cardiovascular events. Often we too will do some screening things on patients, even in as early as late 40s, sometimes early 50s, to look at their endothelial function on their carotid arteries and aorta. And it's simple ultrasound. And the reason is this: you don't have a significant stroke risk till there's plaque or endothelial thickening, until it's about 70% or higher, or there's any form of stenosis, which is like pressure on that blockage. But you can have up to that 70%, and that's considered normal. It's not normal. You weren't born that way. It's not physiologically right, which that with hypertension or smoking or inflammation in your blood can actually give you a stroke risk, okay? We have methods here at Longevity Health Institute that we can reverse plaques in your carotids. Actually, there are studies on this, even on garlic use. We use vitamin K in garlic. Sometimes we chelate patients using IV chelation. Dietary changes, low animal diets, product diets, more vegetable and high fiber diets. So there's many approaches we use here, but good screening, good analysis of your endothelial function, your vascular elasticity, your hypertension, whether it's treated or not. Make sure it's treated to a significant reduction. Lifestyle modifications, okay? And then when you take these things, whether natural, hormonal, supplemental, we need to retest you to make sure that things are improving, not just stable. So that's one thing here. We improve your health. We approach this from a wellness perspective, treating you what your goals are, but also when we see something that isn't normal, isn't physiologically normal, we want to see a result. For instance, 6 months, a year later, we'll ultrasound Doppler carotid. We'll make sure that 50% of that plaque is down to 30%, 20%, and eventually reduced to zero. That's right, zero. We see it happen here all the time. Somebody has hypertension and lifestyle things aren't working, supplemental therapies aren't working. What can we do? What medications are going to give you the best result? Then we retest you to make sure that your vascular elasticity, your core central blood pressure is reduced, so your risks of things like strokes and heart attacks are reduced. So regardless of age, even like Mr. Perry, Luke Perry, being 52 years old and having a very unfortunate young, sad event here that caused his death due to a stroke, that can be and could have been, I guarantee it, prevented, with a personalized wellness preventative approach, looking at functionality. And you hear me say this all the time, those are things that you have to consider, like genetics and hormones and diet and nutrients and stress levels. These are all important, and including mind and body. And so these are things that you want to encompass in a wellness picture that we use here often, and you should consider when you're trying to prevent strokes, cardiac events, vascular events. All my wishes and blessings are to his family, and thoughts are with his family and friends. Hopefully there's some learning and some growth and some information that can get out there about young cardiac and cardiovascular events and strokes. Strokes are thought of people that are very, very old, 70s, 80s, 90s, okay? They're going to happen. but it's not as true now. We're seeing younger and younger events, and these have to be screened and picked up on much earlier. So hopefully this educates you a bit. Share with others, share with loved ones, share with people that have hypertension or you think have hypertension, or they're underdiagnosed or undertreated with hypertension. They live high stress lives, they smoke, they're overweight, they eat poorly. These are people that have higher risks. Share this message with them so that you're doing goodness and wellness for them all around the country, no matter where your loved ones and family and relatives live. They can find wellness, functional medicine, preventative medicine, wellness medicine anywhere. Again, this is Dr. Lewerenz, Longevity Health Institute. Be well.